Last year around when?
August, end of August. Suddenly I have headache, not headache, nausea. Nausea and then like vomiting and all this thing. And that's how it started. Then for almost the whole night, I have this events. Then later the next day morning, when I slept through the night, then that was, I think, was on Thursday, and then Friday, Saturday, Sunday, each day getting better. So I thought this thing just probably some small thing,
Okay.
Then on Sunday night it happens again. Another event came back. I had this problem like nausea, starting to vomit and all this thing, So then I felt that something is not so right. So I have to make a decision to go for a checkup. So first I went to 𝗘𝗏𝗖𝗛𝗏 Polyclinic to see a doctor there. So they do assessment and check. They asked me to go to a ECG, do an ECG, and then they found that I have a heart attack. So they have to send me to a hospital, Sungai Buloh Hospital, by an ambulance. They say you're not supposed to drive here. So I'm not supposed to drive there, also not supposed to drive here. So I was sent there by an ambulance to the hospital. So after that, I have 5 days I stayed there, stabilized. So they prescribed me medication, everything stabilized. So I have to go back. So I got stabilized, and then but I was not given any treatment because they don't have a cardiologist there. So there is a cardiologist, but they don't have a cardiologist department, a center there to do treatment. So I have to go out and go and do more treatment, to look for treatment and all that from a cardiologist hospital. So first I went to a private hospital. I don't know the name. So they check out from my angiogram. They say that my blockage is serious. That I have to do a bypass. So I told them to be arranged, but then I didn't end up doing any bypass there. I went to another hospital, a government hospital. Then from there, the government hospital said that I can do angioplasty, and they're supposed to perform it and do it for me in the procedure, the room there. But then I stopped there because I found that I'm not comfortable with the risk that they say that I have to take about 10% of the risk. So I say no. I'd rather think of something else. So then from there I went through. I got a lot of anxiety. So looking for all sort of way to solve this problem. So go through internet first thing, Google, YouTube. Then I found out that something that can be treated with this problem. There is another method, either from balloon stent, angioplasty, and bypass. There is still another method, which is called the EECP. So then from the EECP, I found that there is also a few clinic medical center that have this treatment therapy, and but from my analytical type of decision, I found that this clinic 𝗘𝗦𝗙𝗎𝗓 are more thorough. That's what I want, integrated and more thorough. So that's why I came to this 𝗘𝗦𝗙𝗎. Yes. Okay. And I make a very good decision. I make a very, very good and right decision, that I didn't end up with other EECP treatment center. I came to this holistic 𝗘𝗦𝗙𝗎. Because this is very comprehensive, very precise, comprehensive, and very thorough. All the things that supposed to do is here. It's not just one treatment and just do this. After that, you go home. That's it. But then, yes, of course, you need time for all this, what I call it, to endure with all these medications, assessment, blood, you have to check thoroughly everything monthly and all these things. You still have to go through this but it is supposed to be or should be this way. It must be this way.
Did you go to the other ECP centers and get information what they do?
Yes, they only told me about just to do the treatment.
Okay.
They never mentioned about nutrition program or any other things that to be continued or whatever things. No. Seems like they only can offer is the treatment, the therapy. One therapy, go home, bye, that's it.
Okay.
Maybe you come back next time, you want another therapy or whatever thing, something like that.
I see.
You just go there and tell them your problem, okay, then you just do another ECP, another session or something like that.
Yes.
It's not like any other consultation or analysis,
Yes.
to find out what is the from the root cause, from the progress, and what is the underlying from the underlying, then to on the way to the what I call it, to everything, to heal up, to the healing, everything, all the progress,
Yes.
the whole journey from the progress, so this thing is very thorough here.
Okay.
Yes, they asked me a lot of questions and checked me and try to look at my history, my past, all these things, what I have done, what did I do, what did I eat, and why I have these things, Then they look into what treatment they start to plan for me.
Yes, so they will go through a medical history, very detailed. Then they'll take you some tests and they gather your past medical records.
Yes.
Then doctor will analyze everything, and then he will tell you your condition, and he will prescribe you. Okay, this is a treatment plan.
Yes.
But you're still in a position that you are not obligated to accept the treatment plan. You still have a choice. Okay, do you want to proceed, or do you want to maybe think or go home or things like that? So what made you decide that, okay, I want to proceed in this treatment?
No, in fact, I didn't stop or what and decide anything. Straight away, I decide.
Okay.
I found that this is the right way, the correct way.
I see.
He just told me that from my condition, I am able to given this therapy.
Okay.
They have to check and analyze first whether I can be given to this any problem with to proceed with this treatment.
Yeah.
So when he told me, then I told him that okay, I proceed, right away.
Okay. And besides the ECP therapy, what else was given to you?
And also, he prescribed me to take some what I call it, detoxification. The whole program, to detoxify ourselves in the midst of doing this, performing this ECP.
Yes.
So after when I finish this, then comes to the part by part. They come to. I believe doctor has a very good, very profound and understanding of how our body respond from what caused the problem and all these things. As I have already spoken to him a lot, and he explained to me very well, and I understand from what he says. After the ECP and after the detoxification, the next program is to proceed to nutrition plan.
Okay.
To build up myself.
Yes.
Because the treatment, the therapy has helped me from my heart, and then the detoxification has cleansed me all. There's a second part. Then the third part to fortify me, to get me more things to nutrition back for my my normal conditions, the gut, our microbiome, all these things is all related to the whole our body. The process is all related to to help us get back to the normal, better person.
So he explained to you that how the condition in the gut can be the trigger to generate those cholesterols to come and accumulate in the
Yes.
So that was a trigger that that is not fixed, no point, then you do the surgery, it's going to come back.
Correct. Absolutely. This is what I believe and other places they will have this type of advice, medical advice or anything to any patients. I feel better every month by every month, consciously or unconsciously, knowing or not knowing, I feel I'm better.
Just consistently you're feeling much better.
Yes.
It's actually giving you much better confidence.
Yes.
And motivation to stay consistent.
Even to the extent that when I realized that I feel better now, how come this is better from last month? I didn't even know that. The thing that progress is, it goes naturally to for this healing. You will be better and better even without you knowing, but you will know when you find it. I can do things like this, I can do things like that. I don't have to be like this, I don't have that, I don't have this already, now I don't have that already, like this condition, like this situation. The progress is, the progress, you will know the progress.
Yes.
I have better energy and
chest pain?
No. Better. Last time, yes. Less and less and less. Until I didn't even know that there is don't have already. Even don't have, I also don't know. I forgot already. I forgot that I used to have a chest pain. Now I don't even have. So things like that. Even the cardiologists, when I went back to see them, they asked, when they talk to me and see me sitting there talking to them, they say, "You come here by yourself? You got anybody following you? You better don't do that." I believe it will only have up to a certain extent, because the therapy itself may do something for a patient, but what is the cause of it? That is the main important thing. The root of the problem must be attended, not only just the cure, but the preventive measure. That is where it is the most important thing is the preventing measure. I'm emphasizing this very crucial. Yes, like EECP is can be said like a bypass or stent, angioplasty or anything like that. It will stop the problem, and then it become like a normal person. But it may have what causes this thing, it will continue again. The progress will still continue. We have to stop the progress. We somehow must stop this root cause and to regress or something like that.
Correct.
Right. So if not, it won't help much for a person.
Probably even after the surgery, you'll get a recurrence.
The recurrence will be back.
Yes.
We don't want all these things happen.
Yeah. That's why many heart disease patients, they have multiple surgeries.
Yes.
One surgery is rarely enough.
And I hope people who have my conditions or who have other health issues and everything look into this, but not just the short term, healing, you know, just do the thing and then finish the thing and then just go home, and then they thought that, you know, everything was back to normal. But the thing's still haunting them. They don't know yet. They don't know.
Correct.
The problem is they still don't know. The thing is still there.
Correct. For example, they will put the stent, open up the blood flow, take some aspirin to thin the blood, and you feel okay.
Yes.
But the progression is not stopped.
Yes.
So you block again.
Yes.
And suddenly you can get even worse.
Yes.
And then maybe at an older age you will not be in a position to go for surgery.
Yes. Or other complication.
Correct.
If there's any other complication arise, that's too late or too sad for them.
Exactly.
But they are very helpful. The nurse here is very, very good. Very, very helpful. And they seem to know also what they are doing. And then they've been trained it well. And they know, they handle things very well, very professionally. And very friendly, very helpful. I have quite a lot of challenges from other people, friends, people who have met them, you know, when I talk to them, explain to them, I have these challenges because I know and I understand them. I understand them that they don't understand what is doing here, what they are doing here.
Yeah.
I wish and hope that they find out more. I really want to help them, and then to help to explain more to them and tell them to come over here and find out more things and all that, rather than just one side. I'm not saying the other side is no good or what. No, I think it should have both, if it can, to synergize, you know, in a way.
Yes.
They can also continue the other side, you know, whatever, you know.
But this will help them to address the root causes and prevent the progression.
Yes, because problems don't come just from one day. It started probably 1 year, 10 years, decades, you know. It's from decades, you know. These things comes when it comes systematically. When it comes systematically, it will go through other parts of the body. So anything can happen. Not only just attending one issue of the problem. When you have attended, it may happen to another part of the body. When you have attended that part of the body again, it will go to another place. So, like I said, systematically. So why don't you just go? This is what I call holistic. The word holistic is called whole, HWOLE. That means the whole part of the body to be attended to look into the cause, and then to how to make it back to normal, into a normal being. I would advise them, don't look at just after the treatment, everything that is back to normal. Don't just attend that, but ask yourself what happened actually, you know, the cause of it. Is this problem has been tackled from the root of the cause, or is just temporarily?
Correct. Exactly. So you need to find the root. Otherwise, you don't just say after the treatment feel you're okay and then everything is okay.
Yes.
Because even statistics, they show most of the heart surgeries, they will surely get the recurrence. Most heart patients, they get the recurrence. So your advice is very, very logical and very insightful to those who...
When I was in the hospital, that's what I saw and that's what I heard. When I asked people around, most of them recurrence. Most of them, 2 or 3 times. There is not a good history. There's very bad history.
After surgery, regular?
Yes. That's why I look into why I don't want this thing to happen to me. I want something that, properly treated,